So today we're here to talk about an introduction to health literacy for community workers. So some of this might be pre-existing knowledge for some of you. Some of it's going to be fairly new. I hope we get a good mixture of it. Before we kick off, I want to acknowledge that we're all meeting on the land of the traditional owners in the ACT. That's the Ngunnawal and the Ngambri people. And if you're from across the border, then pop which land you're on in the chat. And I'd like to acknowledge their continuing contribution to Canberra and the region in particular, and pay my respects to the elders past and present, and particularly reflecting on the difficult time we've had around the referendum. And of course, pay my respects to any Aboriginal and Torres Strait Islander people who are here in the group. So a little bit about us and what we do. As I mentioned, I'm the health literacy officer here at Healthcare Consumers. And so my role is to do things like this, educating community workers in the health system and demystifying that a bit. I also do that with consumers and work with the health system to make things more understandable for those using it. And we've got one from Darawal, excellent. We'll be we also at Healthcare Consumers have people like Penny who works on multicultural liaison, making sure that our health services are accessible and sensitive to cultural needs. And we also have research, advocacy, and a really large pool of members in our organisation that may become representatives on health services committees. And we're all led by those members in what we do. So our vision is consumers in control of their own health. Right. Bit of an overview on what we'll be talking about today. So I'll do a bit of an overview of exactly what we'll be talking about in our aims here, but we're covering health literacy, the sort of what, why, who, when, and where of that. What your role is as community workers, how you can improve health literacy and where you fit into that puzzle. We will have a bit of a break since we've got a couple of hours scheduled. I wanted to build in a break. It's a lot to get through. And we'll then talk about safety and communication in healthcare and some tools and tips around that, because those are some really key areas where we can help people improve their health literacy. In terms of our aims, by the end of this, hopefully you should be able to understand what health literacy is and why it's important, be able to recognize when someone's experiencing demands on their health literacy. And what I sort of mean by that is when someone's skills don't quite match up to what's being asked of them and that sort of thing. And how to support your clients to ask questions to get better healthcare. Along the way, we'll share some useful tools, tips, resources that you might use going forward. And there'll be some links to follow those up afterwards. So the first bit that we'll be talking about is, well, what is health literacy? It seems like a bit of a jargon term, and it does come out of academia, really, but we're applying it in the real world. So what is it? So this is the definition that Healthcare Consumers uses in our own health literacy policy and to sort of drive all our work. And it's that health literacy is the combined knowledge, skills, confidence, and motivation used to make sound decisions about your health in the context of everyday life. So it's possibly a new framework for you, and there's a few different definitions. We just find this one's really useful. So you might think about, what does my client or my community need to know about healthcare? What do they need to do? Or what do they do well already? So you can approach it from a strengths-based standpoint. What are they able to do if they're confident enough, if they got the support? And of course, motivation. So do people actually want to follow through on their health information? So knowledge and skills are pretty obvious. You might give someone a fact sheet, you might train them to do something, but confidence and motivation tend to be those tricky ones. And it's where the community workers have a really important role, because people can have all the information at their fingertips, but that confidence is something that we can really work on with people. And those from like the mental health space may be really familiar with sort of empowering people to look after themselves. That's a really important part of this. And of course, motivation to negotiate the health system can be really difficult, especially where people have had hard experiences in the past or are facing discrimination barriers, those sorts of things. And it's important to be aware that people could be really health literate in one area. So like myself, I have a few chronic illnesses. I'm really good at working with those. But if I were to get a big diagnosis tomorrow with something like cancer, I would have no idea and I would not have the skills. So that it changes depending on what context you're in. Another example would be that some people are really good at like following instructions, understanding how to take their medications, but you ask them to navigate their way through aged care services, and that confuses a lot of people because that system is completely different. And that's one you might encounter out in the wild. So I'm curious to hear from you all before we move on that for most of your clients, there may be one particular area or a couple of particular areas that cause the most difficulty in the health system. So I want to chime in with some examples.
Hi, this is Angela. Can you hear me?
Yeah, we can hear you.
Okay. Hi, I'm a care finder, and um, the situation that I'm thinking about is I have a client who does have knowledge and usually has motivation about his particular condition, which is diabetes. But then when his mental health takes a nosedive, he tends to stop taking care of himself. Um, and then doesn't really understand the cumulative effect of those periods of time when he stops taking medication and stops looking after his blood sugar levels, etc. So,
Yeah, that's a really good example of a particular area, and that interaction of physical health and mental health can be real issue for some people. Certainly, that's a great example of motivation, and we might call back to it as we go on because there's a few points where that exact example is really relevant. Is there anyone else who has a particular area they hear about a lot? All good. Well, I mean, for me, one of the ones that comes up a lot is like aged care and the NDIS. They're not directly part of the health system, but a lot of people who can get through the health system really well, when they get up against those systems, completely flips the script, and that becomes a hard one for them. Haley.
Yes, can you hear me?
Yep.
Perfect. I've dealt with a lot of people who have been discriminated against because they do actively inject drugs. So they're fearful of presenting to the emergency room or accessing doctors because they're scared of being discriminated against. So there's often the barrier of trying to be like, no, you're safe, or like trying to have a warm referral to other health community services. So it's sort of just having to help them, sort of give them confidence they're not going to get discriminated against like they have in the past.
Yeah, exactly. And that's a really good example of where, as community workers, we can contribute to things like confidence because, yeah, people have had tough experiences. There is stigma. And as much as we can try to combat that, also giving people the confidence themselves is really important to get them to actually access healthcare. So that's broadly what health literacy is. And you can see how it ends up applying to a lot of what we do. So the next bit is another part of health literacy that we just might not talk about much, and that's health numeracy. A lot of people might have a bit of a fear of maths because of the way it's taught, and health numeracy is relevant to that because when we talk about health literacy, we've got those skills that require a level of understanding numbers or being able to measure things. So it's that quantitative information that people might get about things like risk or taking medications, things like even physically measuring out the right amount of medication to take. So it could also include some physical barriers for, say, someone who's got arthritis and their hands don't work quite that well. So health numeracy, you've got to understand how numbers work and then be able to apply them, similar to the rest of health literacy. And it's just a good one to highlight because especially when it comes to medications, it's an area we might not have thought of. So if someone's got low numeracy in general, great literacy, then there's a stumbling block there. Does anyone have any thoughts on like what some specific barriers to health numeracy might be? One that I've got coming up a lot lately is costs. So people working out how much something is going to cost, whether they can afford it, then becomes a barrier to whether they can access services. So whilst they'll have the knowledge, the actual ability to get there without support is quite hard. Did I see a microphone flick off for a second? good. We'll move forward. So why is health literacy important? And I've got this graphic from the Australian Commission on Safety and Quality in Healthcare, and they have quite a few good resources on understanding health literacy you might access. So low health literacy, again, context dependent, can affect you in sort of these ways. So it affects your ability to seek support, for one, so just finding the right space in the system. Of course, navigating that health system, so understanding private and public, understanding that a walk-in centre can treat you so you might not have to go to emergency, all of that sort of thing. Nutrition is a big one that is impacted because we get so much information about food. And so if someone's got lower health literacy, they can't check how good quality that information is. People might jump on fad diets and those can be harmful. Things like just organizing your healthcare appointments. So the Medicare billing scale, very confusing, and people don't know that you can get double appointments and that might cost differently, all of that sort of thing. Even just filling in paperwork. And of course, analyzing risks and benefits, understanding medications. So those are all things that make health literacy really important. And lower health literacy, because of all of these, can lead to like delayed presentation to your doctor or even to emergency if something gets quite severe. And people present like later stage in illnesses. So they get worse outcomes. You might not get diagnosed till later. And that has even more impacts on things like costs, general well-being, work, which of course then has flow-on effects for the rest of people's lives, and can have quite a big impact on things like even life expectancy for people if a certain community is disadvantaged in health literacy. So yeah, it increases the risk of things like serious illness. You might get worse because you don't know what the warning signs are for a particular thing, needing emergency care more often, or even presenting for emergency care when it's not an emergency is a big one, particularly with how overloaded our system is. Poorer health in older people is a pretty clear outcome because these sort of things, like that diabetes example that Angela mentioned, builds up over your lifetime if you have those rough periods. Mismanaging medication, and I actually do an entire talk for community workers about how you can support with medications because it's such a big issue. It's something like a third of over 65s presenting to hospital are related to medication in some way. It's quite a big one. Things like not getting the flu vaccine or vaccines in general, and we've got quite a few preventable illnesses that people may get because they're worried about vaccines, they don't have that knowledge. And things like being hospitalized more often, not understanding your own diseases and conditions, which might be manageable if you had a bit better health literacy. Just seeing one of the comments from Delai. So 30% of people that I work with are from the CALD community, and language barriers, service navigation is hard for them. Even booking an appointment is difficult for them if they don't understand English, can't use digital devices. Yeah, so there's quite a few things that seem fairly simple to a lot of us that they're just a few barriers. Things like access to digital technology can play a role in. All right. So who are we talking about when we're talking about low health literacy? So in the ACT, and these statistics are from the Australian Bureau of Statistics, they've got like a 9-point measure of health literacy around your everyday tasks. And in the ACT, it's about 44% of people who would find it difficult to do everyday health tasks. And when I say everyday health tasks, it's things like calculating doses of over-the-counter medications, making decisions about their health, managing their appointments, all of that sort of thing, and even just communicating with a doctor. The ACT does pretty much the best in the country out of this because of how educated our population is in general. And Australia-wide, it's about 60% of people find it really difficult to do those everyday health tasks. So this is a problem across the board that we can all work towards addressing. One of the some of the groups that we see that are most at risk of low health literacy, and it's important to say that none of these are inherently low in health literacy. It's more of a factor of all the systemic factors that go into people having less educational opportunities or having language barriers, that sort of thing. But the people we see who are most at risk are older people, people from lower socioeconomic groups, Aboriginal and Torres Strait Islander people, Of course, the culturally and linguistically diverse community, as we've had some examples of, people from the LGBTQIA community, and that one is also related to discrimination and poor experiences. Carers, which when I've worked with carers, one of the things that often comes up is around that motivation, because they're focused on the health of someone else, and taking care of themselves is the barrier there. Yeah, anyone who's got limited education access, and that flows on to say people with disabilities have barriers in the education system a lot of the time, or might be excluded from mainstream education. So that means they may not have the mainstream knowledge that is expected for interacting with the health system. And that's on top of if they may have a disability that affects communication. We have things like chronic disease, complex health issues. The bigger your health issues, the more complex they are, the harder it is to keep your head around it all. And of course, people with trauma, particularly health-related trauma, often have issues. But the thing I want to highlight here is it's all of us at some point will have low health literacy. This is a lot of skill-based stuff, but even those of us really highly educated, I've had doctors say to me that all my knowledge goes out the window when I'm, you know, the one in ER, or I'm the one who's been diagnosed with cancer. That sort of stuff can completely derail your health literacy and your understanding of the system, or just ability to deal with it. So we like to say that health literacy is a state, not a trait. It's not just a cute rhyme, but it's a reminder that we all have low health literacy sometimes. And some of these strategies you might even end up with keeping in your back pocket for if you end up unwell. What that also means is that we can change it. And that's a really important thing for us to remember here. So how do we know that someone's having trouble with their health literacy? How do we know that the health system is asking more of them than they've necessarily got? These are some examples that we hear about, and you might be able to give some more. It's things like making excuses. So I forgot my glasses. I'll read it when I get home. That could be a sign that someone actually just can't read the information being put in front of them, or they need more time with it, and they're embarrassed to say so. That's sometimes the case. Using humor is another one, sort of clowning around to try and make things seem less serious. Not wanting to go to health professionals full stop. There's that reluctance there. Someone's asking no questions. That can be a bit of a red flag, because that might mean, of course, it could mean you understood everything perfectly the first time, but it could mean that there's a language barrier and they're not quite understanding what's being said, but it's embarrassing to say so. It could mean that certainly for a lot of older people and for people from certain cultures, doctors are authority figures, and questioning them might be considered offensive, or they're just not used to the fact that you are allowed to question. If someone's frequently missing appointments or tests, that could be another flag. Not sticking to medical treatments and plans. And the classic one that we hear, especially from the mental health space, is that people are non-compliant. Maybe more of there's an issue here with motivating them or making sure that they actually understand the actions. Could be overuse, underuse, misuse of the medical system in general. So we talk about things like people going to emergency when they don't need to be, or they might not want to go to a specialist because they don't understand how that system works. They think their GP can handle it all. There's those misunderstandings, and difficulty making sort of informed choices. So they're using the information they're presented with. Some other ones that you might want to watch for us, particularly if some of you are working in that sort of community health space, are things like incomplete forms. If someone might not be able to articulate or just doesn't know quite what a question is asking, that can be one. And of course, people waiting until they're so sick that they really need that emergency care. Another one might be that people just can't name what medications, treatments they're on, or even what conditions they have. They just can't really articulate that to you. Can be a flag as well. So are there any questions or ideas around that? Yep, Penny? I can't hear you.
Sorry, there's a question from Hayley about what you mean by no questions. That was on a chat in that point 3, ask no questions.
So hopefully each doctor at the end of an appointment would be asking someone, do you have any questions? And when someone really has nothing, that may be a sign that they haven't absorbed the information or reflected on what's being asked of them. And that's where we might go, is there a language barrier, or is this being explained in a way that isn't really actionable to them? So they've got no questions about that. Or there could be that authority issue for them. So those are some signs of health literacy. But just to illustrate how demanding healthcare is, and it's gotten worse over time, is that really we have consumers over here saying, I just want to see a health professional and I want to feel better. And what's being really expected of them is things like making and keeping appointments, remembering your medical history, giving that history, giving informed consent. So you've got to absorb the information, work out if it's right for you, and give it back. Reading and using that health education material, paying bills on time or understanding when there's going to be bills, going home and managing care in a whole bunch of ways. And we've seen this kind of get more and more on the individual to manage rather than on health professionals over time, which means this is getting more and more difficult for people, and we're not necessarily educating them in a way that means they can manage all this demand. So we haven't really been increasing the communication strategies to go with this increase in demand. So we're coming to our first whiteboard moment, and I'll pull that up in a sec. So what I want to think about for the next 5 or so minutes is, what do you notice with your clients when they're having trouble managing their health or with the health system? So I'll just jump out of my share and give you all the whiteboard to start adding things. This one. Okay. So let me know if you have trouble with this. You should be able to use the tools on the side, pop up a post-it note or a square and put in some ideas that you have. I'll give you a few minutes to do this. Okie dokes, I'll start reading a few of these out. Let's see. So we've got things like feeling frustrated. So yeah, that's a really common one, is people just feel frustrated with the system and how it's working. I've got specifically near that one, frustration with waiting times for specialists, for sure. That could be quite a hard thing to find. Doctors not listening to the wants and needs of patients, for sure. Yeah. A lack of drive and confidence to advocate for themselves. Yeah. Coming in very upset and frustrated, missing doctor's appointments, less interest in seeking support. That's a big one, that once people have had a few bad experiences, coming back. Wait lists, again, not having just no clear understanding of the health system and how to navigate. Yeah, our health system is quite complicated. Deterioration, of course, we've got that physical one, frequent hospital admissions. These are great. Excellent. All right, well, I'll let people finish up those and just close that whiteboard. All righty. So yeah, you can see that all of you have seen this in the wild. All of you have worked with clients who've had some of these difficulties we're talking about and seen the effects of it. And that's really what I wanted to establish there. All right. So we've seen what is, oh, there we go. Yeah. So we've seen what is health literacy and where it applies, who it happens to, who might have low health literacy, all of that. But there's a bit of an other side to that. It's not just about the individuals and how they are skilled, whether they're knowledgeable enough, all of that. It's also the health literacy environment. So the health environment, where this health literacy applies, is pretty much everywhere. So things like buildings and how easy they are to navigate. Have they been designed well? Certainly, one of the things that I talk about a lot is signage and whether it's actually visible and usable for people with low vision, or certainly for people with a different language background, if we've got really complicated language on our signs, how do you find where you need to go? Policies and processes. How easy is it to fill in your forms? Does a patient need to talk to 3 or 4 people before they get to the right spot? It can even be as simple as how your phones are managed, that sort of thing. Got signs and maps. Are there maps available? Are they clear? All of that. Handouts and letters. So are they written in plain language? Is there images to explain the point? Are they logical so people can actually put into action whatever's on that handout? Websites. How well designed is the website so people can find things? Is it logical? Does the search function work? A lot of health websites have pretty poor search functions. So that is a really key mechanic for people. And then we even have that interpersonal communication, how staff are trained to interact with people. That includes things like disability awareness, awareness of people who've used alcohol and other drugs, and making sure you're not stigmatizing them, because that's not something that the consumer can change. That's something that the staff need to work on and the system needs to work on. And then we also have media. An obvious example is through COVID, the way that media was sometimes sharing misinformation. And if people don't have the individual skills to critique that information, it can be really harmful, but they can't really control what information comes out. So all that is to say that it's a partnership. We've got that individual health literacy, which is what we can support people to work on, but there's also that health literacy environment, how it's designed, how the system works. And those have to work together for people to understand and be able to act on the information about their healthcare and be able to take care of their health. And there are barriers and enablers for people on both sides of the partnership. And as community workers, it may be that for you, you want to find a way to give feedback into the system and contact your, the local hospital, the health service, work with one of the health consumer bodies to make sure that what you're seeing in your clients is actually being told to the system so they can improve. So that's to say that you can have a bit of a role in feeding back into the system. A bit more on your role as a community worker. So this model is from a European study. And you can see we've got those green bits, which is the health system and health professionals, and the individuals and their sort of context. And those two interact in a bunch of different ways to get better health literacy outcomes. And in this case, they're talking about healthy aging, but it can be applied to health in general. Down the bottom in the yellow, we've got different health literacy interventions. So changes that can be made, programs that can be implemented to improve these. So community workers sort of fit in those two on the left-hand side, the community support empowering persons with low health literacy. So you can do things around providing community support yourself. So we've talked about like confidence and supporting people there. Empowering your clients' low health literacy. So that could be sharing some of the tools that we'll go through, connecting them to other services as well. And helping clients communicate with health staff. I've talked to, say, disability workers that might go to appointments with the people they work with, but it can also be giving people some idea of what questions to ask, or some tips on how to advocate for themselves, that sort of thing. So there are some interventions there, and there are other ones to work with health professionals as well. Some of the activities that support health literacy, some of them are fairly obvious. So education sessions from health workers, you might get an outreach worker in to talk about, say, sexual health in your service. Or I go around to all sorts of different groups, as does Penne, to talk about the ACT health system, how it works, just the basics. And those sessions can be really helpful for people. But it can also be things like computer skill tutorials. There are a lot of like older persons organizations that have a program there to teach older people to use technology. And if they know how to use a phone, use apps, then you can equip them to use a lot of different digital health tools. So it might not be directly health related. Could be sharing health resources with your clients, whether those are fact sheets, having we give out magnets with Health Direct and their nurse phone number on them, like nobody's business, because that's such a useful service. Providing access to technology. So libraries worldwide are used quite a lot in health literacy because they provide that access to free technology, scanning even, so that people can ferry their medical information back and forth. Transport to appointments is one. Like if you've got a community shuttle bus, then that takes some stress and really helps people to get to appointments where they might need to travel a bit, they might not drive. So that's something you can do. And even things like social exercise programs, you might not be talking about health at all, but just giving people a reason to go out and do some exercise, whether it's like youth basketball program or an older person's walking group, that's also enabling people to do something about their health. So those are some things you might already be doing to build on. So you can think a bit outside the box with what health literacy interventions you might do. So further on your role and applying that sort of those 4 principles. So you want to be thinking about what does a client know or need to know? And if we're looking at strengths-based sort of work, what do they already know that they can put to use? Looking at their skills, what do they do? What do they need to do? What can they already do well that could be applied to their health? Confidence. So where are they confident or not confident? How can you help boost their confidence? Is it things like connecting them with peer support, or is it really just sitting down with them and talking about their rights, working with them through that? Motivation. Do they want to do something? Do they not want to do it? How can you motivate them? One of the other training that we've put on for people is around motivational interviewing. Some of you might also be familiar with the sort of techniques used in like smoking cessation, and those sort of motivational tools fit really clearly within a health literacy model. And then of course, I've got what feedback can you give the health system to address that side of things? So if you remember that know, do, can do, and want to sort of grouping. We're going pretty well for time, so I'll stop for a minute and ask people sort of how might you identify what skills, knowledge people already have that they can apply to their health in your work? Does anyone have any ideas around that? I mean, to put it another way, how do you work with your clients to sort of identify strengths or weaknesses in that you might be able to address?
Sorry, Guy. With a lot of our clients, we sort of start to the discussion of it does go a lot to my aged care with the clientele, but we start to discuss because I'm in a short-term program. Sorry, I was trying to phrase this properly. Because we're in a short-term assistance program, start the conversation on long-term my aged care assistance, and also sort of longer term, or just within the next few months or so, what sort of interaction they're going to have with healthcare professionals in general. We might not be there for the whole time that they're doing this, but it's just starting the conversation of getting them involved with contacting the My Aged Care, getting supports in place, or at least knowing how to get supports in place when they need it, and making sure they can get to these appointments. Again, may not be directly through us, but if they've got that connection in place already with, say, My Aged Care transport, stuff like that, then that's what we're after, just starting to open them up to the fact that this may need to be ongoing down the track. So yeah, not direct sort of healthcare, but again, it helps them keep on track longer, I guess, if they've sort of got that in place.
Yeah, absolutely. I mean, looking after someone overall will help their health and well-being. And so you're looking a little more long-term than they might be, and starting to identify where there could be some problems for early. So that's a good one.
Sorry, I'll add to that. There is also the, NDIS side of it, just really sort of starting the process of getting them to ask questions of their doctor. I mean, it's a big process. How many of us know a lot about that process? So just getting them to start asking questions and taking a step forward with it, because it's a lot for a lot of people. Sorry.
Yeah, absolutely. And starting that step forward early, breaking it up a bit into chunks is a good way to approach it. Delai's got asking where do they usually go to see a doctor if they have a usual GP. Yeah, if whether someone has a usual GP or not can have a really big impact on how easy things are. So it's a good question to ask. The next one I've got is talk them through the steps they will take to organize appointments, provide resources to point them in the right direction, plan questions to ask. Yeah, that's exactly what we'll be talking about as we go. So that's another great one. Excellent. All right. Well, I will give us a few minutes break. So if people want to meet back at 5 to 2, jump up, have a stretch, grab a drink, and then we'll get into some meaty stuff. So back here at 5 minutes to 2. Okay, on to some meaty bits. And I'll just make sure I can see the chat. Okay, so the next bit I'm going to talk about, folks, is safety and communication in healthcare, because these are sort of the key areas of health literacy we can start to act, but there's a lot more to it than this. We're keeping it fairly simple for this intro. So first, I'm going to talk about some risks in the healthcare system. And these ones come from the World Health Organization. So these are statistics on countries with high income, so like Australia or the US, though their health system might not be comparable. And there's sort of, these statistics are like 1 in 10 patients in hospital care will get some kind of harm, and half of those will be avoidable. And when we talk about harm, it's physical, emotional, or financial. And if we're talking about primary care, outpatient care, so things like seeing a GP, it's about 4 in 10 patients that will experience some kind of harm, and about 80% of that is avoidable. One of the ways that this can really be combated is effective communication, so that patients are engaged in their own care and making sure they have a say in how they're treated, making sure things are relevant to their lives, those sorts of things. Other reasons that things can go wrong are that our health system's becoming more overloaded. And I think since the last time I delivered this talk, I could say it's even more overloaded than it was. The self-care demands are increasing on people, as we showed with that chart earlier of the demands versus what people sort of expect. Hospital stays are getting shorter, and that's an interesting one because in some ways it reduces risk, because the less time you're in hospital, you're less likely to get something like a hospital-acquired infection. But also people might be pushed out before they're ready, or they might not get the supports at home that they need. We've also got things related to like the aging population. So more people are taking more medications and taking them for longer, increasing prevalence of chronic disease. So there are more people with chronic diseases and with more of them. So that makes it a bit harder. And then there's those attitudes from patients or issues for patients in communicating around not speaking up, not giving all the information, because they might not be sure what information is needed to doctors, not understanding how to take their medicines and follow those instructions. So all of those health literacy issues contribute to this. And just fundamentally, humans aren't always the best communicators. It's a conscious skill you've got to develop, and making sure that doctors develop that skill needs more time dedicated to it. So can anyone here give me an example of a harm that's being caused because of a client's low health literacy, or because on the other side of things, the health system hasn't been particularly health literate for that client? I don't quite believe that there's no examples.
I might have something that's kind of every so often I'll come across somebody that will be saying they don't know what medication they're on. when they do have a visit to the hospital. And of course, you encourage them to ask what it is and everything, but it may just be miscommunication. Just because I feel like every time they go in, I don't believe that they're not being told. Maybe it's just that miscommunication and misunderstanding of what it is all for.
Yeah, and that's a common experience that I've heard as well, is that people don't know the medications they're on. They're not getting the information from the hospital side of things when they're leaving, for sure. And yeah, if people don't know what medications they're on, there's a whole lot of risk there if they don't know what side effects to look for and all sorts of things. Yeah. Any other examples of harm that might have come about because someone's had that low health literacy or the system hasn't quite worked the way it should? Angela.
Hi. I had a client who was in kidney failure and who neglected to connect with the specialist because transport could be provided, but he literally couldn't get down the stairs in his home to access the transport. And there just wasn't a way within the system to make that work for him quickly enough to be able to get to dialysis.
Yeah, so that's a real example of harm. And I mean, I mentioned transport earlier for a reason, because it's one of those community things that might not be considered part of the health system, but it really plays an important role to getting people to care. And even if that's assistance to get someone out of an inaccessible home. So in terms of how your role applies to this, oh, we've got one more example. A participant I work with has a lot of trouble with doctors ignoring her own knowledge about her health, which kept delaying getting treatment for what she actually came to them for. Yeah, that is an experience that unfortunately I know I've heard about a bit and experienced myself. That care's gotten delayed because people haven't been believed, for sure. So that's one of these sort of harms. And that's not just the physical harm, the emotional harm that happens to people there. And a lot of that can be improved by there being better communication training on the environment side and better support for the people that we work with. So your sort of role in this is knowing what your client's strengths and what their difficulties are, and having a bit of knowledge about the complexity of the health system so that you might be able to flag where that harm is, help to decrease it, and of course, increase those positive outcomes. So things like supporting people to get transport or advocating for change in the system where something hasn't worked because people might be able to do it themselves. Of course, there's also part of your role is sharing tools, connections to other services. And I'll run through a few of the resources that we really encourage people to share around this in a moment. So the first resource that I really want to contribute with, you may be aware of it already, but I'm always surprised by how many people don't know about this. So in Australia, again, from the Australian Commission on Safety and Quality in Healthcare that did those health literacy graphics earlier, they run the standards for healthcare, and out of that comes the Australian Charter of Healthcare Rights. So this applies in every healthcare setting for everyone using healthcare services. And there's 7 of these rights. The first one is access. You should be able to access a service equitably, so on equal ground with everyone else, and that they need to make reasonable accommodations for you to access that service. You've got a right to safety, of course, and that's both physical safety from harm, but also emotional safety. And more and more, we're talking about cultural safety for people. You have, of course, the right to respect. And at least in Canberra Health Services, they also include respect as one of their values. So reminding people that you should be respected in health services. And that includes things like your knowledge of your body and your conditions. Partnership. So people have a right to understand what's going on for them and contribute to the plan for their own care. And that also includes their family and carers that should have a role in people's care to make sure that it suits them. The right to information. And here we're talking about just getting information about your own health. So your medical records, you have a right to your own medical records, but also you should be able to get information about your health in a format that you can understand. So that includes things like getting interpreters. And we often emphasize that you have the right to an interpreter and it's free. The health service needs to organise it, that sort of thing. The right to privacy. You shouldn't be having all your details shouted over a waiting room, and it's okay to say, hey, no. And your information can be protected. And then, of course, the right to give feedback. That everybody has the right to give feedback, and there's an obligation for services to act on that feedback or at least respond to it. So with these rights, one of the best things that you can do is make sure that people know their rights in healthcare, whether that's sharing this, having pamphlets, just talking to people and making sure that they've got it in their back pocket. I know for a long time we gave out bookmarks that just had your rights on them. And you can explain those rights to your clients, reassure them. So again, that confidence motivation that they have rights if they're using a service, and particularly where people are maybe new to the Australian healthcare system, and combating that sort of authority idea, that these rights go some way towards that. And of course, supporting people to give feedback and make complaints if they need to, because yeah, knowing your rights can really help you get what you need. And there's more resources on this that you can download, posters, flyers, everything at that link that we'll send to you as well. And Pene's popped in the chat. The next bit that I want to share with you is these top tips for safer healthcare from the same lot. And in addition to this, we've also recently published some booklets on staying safe while going to hospital. And those are pretty specific to preparing for when you're in and coming home from hospital. We'll share the link. These are more general in healthcare. So their top tips are asking questions, and we'll get to asking questions because there's a reason it's number one. Making sure you ask questions about your healthcare to get the answers you need to act. Finding good quality and reliable health information. Again, we give a whole session just on helping people work out what's good quality information, what's not online. And that's the sort of thing where you might have a role to play in skilling people up, or even just sharing information from reputable sources, which a lot of organizations did around COVID, and you might do around like flu season, getting your flu shots. Understanding the risks and benefits of medical tests, treatments, and procedures. So people really need to understand the information given to them, process it, and know what the risks and benefits are for themselves. Things like keeping a list of all the medicines you are taking. We've talked a bit about people not knowing that, and whether it's just people having a template so they can keep a paper copy, or more and more people are able to do it through an app. Most pharmacies have one now, so I know my scripts get automatically updated without me having to remember a thing. But NPS Medicine Wise has an app that anyone can use, regardless of what pharmacy they use, which also has things like a carer mode, so anyone caring for someone else can track their medications. Things like confirming what will happen before a procedure or operation. People sometimes assume the doctor knows what they're doing and that they're doing it to you and you're the right person in front of them, but making sure that they've identified the right person, that you have the same understanding of what procedure is happening as the doctor, so that there's no surprises there. Asking about your care when you leave hospital, that's things like those discharge summaries. I mean, when you're leaving any service, you should make sure you've got some kind of summary. And knowing your rights, it's number 7 here. I'd put it higher if we were going to rank them, but knowing your rights is a big one. We've got understanding privacy and accessing your medical record. So it's not just that right to privacy, but My Health Record, as of course that national system. Do people know how to access that? Do they know what's on it and what it can be used for? Because a lot of people might not know. You can find your test results on there. You can find what your Medicare claims have been, so you can check the dates of appointments, that sort of thing. You can even put an advanced care plan up there. And in the ACT, we've got this digital health record system, and understanding how to use that means you can check on all of those things. I think over lunch, I got a test result back and that means that I know whether or not I need to go to a doctor or not. And knowing that your feedback is really important to improving that healthcare safety and quality. So making sure that if you're seeing these recurring issues, they get fed back into the system, or people know how to make complaints if they need to, that sort of thing. So I think Penny shared the link in the chat. There are booklets on these and how to do it, posters, videos, sharing these with people so they've got some concrete tips on what they need to do to stay safe is a really helpful thing. And we'll, of course, share out those booklets for if you're supporting anyone going into hospital. All right. So some things that you can do beyond just this to keep your help your clients stay safe is things like reminding them to say if they don't understand the information and get people to repeat it, asking for information to be presented in a different way, and telling health professionals they need more time to make a decision. Those are sort of 3 other things that you could also include here. And now we're going to jump into another whiteboard where I want to hear your ideas on what the barriers are to good communication in healthcare for your clients or even your community. What are some things that stop people from understanding what's going on or even how they speak to their doctors? And I'll just pull up that whiteboard. My Zoom's gone a little bit odd. That's embarrassing. Here we go. So I'll give you a few minutes to put down some barriers to good communication, and you can think pretty outside the box with this because communication affects everything. I think most people I can see are done typing. I'll start reading some of these out if anyone's sneakily doing one in the background. So some of the barriers that you've all seen to good communication in healthcare: short appointments, that's a big one. Appointments getting shorter and shorter, and GPs doing the 5 minutes from one person to the next for sure. Information from specialists not being sent to the GP, yeah, and I mean vice versa. Certainly, there's an expectation that that information will be shared, but if it isn't, then what are you going to do? You don't know what you don't know. That's a big bit, is that if people aren't given some awareness of the health system, they might not even realize how complicated it is, and that they've got to communicate knowing that. Arrogance by specialists, yeah, certainly that comes back to that respect point about respect for people's knowledge of their own body. Language, yeah, and that can be a language other than English. That could be people using Auslan and whether there's support there, but it could also be stigma. Or listening skills from doctors. Yeah, how are they listening to people, and are they checking they've understood? Doctors not providing instructions in other formats. So yeah, asking for things to be written, or whether they can provide things like videos. We often encourage that from doctors, seeing patients as a number instead of a person. Yeah, and if you're doing those 5-minute appointments, as many as possible, and see how that would happen. Assumptions, just in general, that's a big barrier to communication. Yeah, not using plain English and assuming, stigmatizing language, doctors ignoring nonverbal communication. Yeah, that's a skill that doctors may not have learned, is how to observe that nonverbal communication, especially if they're looking at the computer rather than a person during the appointment. Emotions, stress, yeah, that definitely affects it. As I've mentioned earlier, your health literacy might fluctuate. Rushed communication, yeah. Repetitive answers and information, yeah. Sometimes things are over standardized, so we get the same information over and over again and not information specific to us. Busy doctors, yeah, and I can't take the time for communication. Complex terminology that needs some explanation. So yeah, there's lots of jargon in medicine and they don't realize it. Language, stress, anxiety. So these are all some, yeah, really tough barriers. And some of them we can skill people up to address, but there's also got to be that give from the other side of the system. Things like short appointments, that's part of the reason we emphasize so much on how people prepare their questions, which I'll talk about in a moment, to kind of prepare for the fact they've only got 5 minutes. and things like encouraging people to record their appointments if they can, whether taking notes or asking to record on their phone, because things might be written down for them. This is good stuff, folks. All right. Are there any other comments on that? Hayley?
I do have a question. I read online somewhere that you can request the doctor to note that they have denied your request for like an ultrasound or something. Is that true?
Yeah, I mean, that's not necessarily a formal note in any way, but you can ask them to put that in your file if you really disagree with the decision, and that's something people can do to sort of have a record. And it's a good idea to have that in writing, but it's another reason why people might ask going into an appointment, can I record it on my phone? Most doctors are okay with you recording the audio of your appointment if you ask. I like to give people a template so they can take notes physically, but otherwise that's also something you can do. Yeah. Any other comments or questions about some of the stuff that we've just come up with? All right, we'll move on then into my screen. Okay, so that was a good one. But several of the barriers we talked about there can be partially addressed, at least, by knowing how to ask questions, being equipped with some questions. And just telling people to ask questions is not the most helpful thing, but we can actually equip people with good questions to ask. So questions are sort of this key bridge in understanding from what the health system might provide, clarifying things. So the first set of questions that we give to people is this sort of simple version, Ask Me Three, which is 3 questions you can ask at any appointment to hopefully walk away with the information you need. So what is my main problem? What do I need to do? And why is it important to do this? And if we look at that from our sort of 4-point health literacy, knowledge, skills, motivation, confidence framework, what is my main problem is giving you the knowledge of what's going on, whether it's a diagnosis, whether it's them telling you, well, these are the symptoms and we don't know what's going on. So that'll give you a bit of knowledge of what's going on. The second question is, what do I need to do? So that's about the skills. What skills do I need to move forward from this? There might be a bit of knowledge if it's as simple as just as getting a prescription. It's just knowing what that is and having it. But there's skills in that, in taking medication correctly. It could be that you need to go do an exercise program and don't know what you're doing, so you might need to go see a physio, that sort of thing. Why is it important for me to do this? This is where people might get a bit of confidence and will definitely get a bit of motivation. It'll tell people the urgency of what's going on. So if you say, why is it important for me to do this? Doctor might say, well, you need to go get this test because it could be cancer, it could be nothing. And if it's cancer, then that's pretty serious. And that's a fairly motivating thing for a lot of people. But likewise, if someone's been prescribed antibiotics for a minor infection, saying, why is it important for me to do this? Well, it'll clear it up faster. It might not, it might clear up on its own either way. So it gives people a bit of that idea of the urgency, the motivation, and the why is a really key part in getting people to move and act on things. So these 3 questions, whilst they seem really simple, they can be a really valuable tool, especially if you might hit that stress point. So I personally, and I've told other people to do this, is keep them on a card in my wallet so that if I end up at emergency or I've got a doctor's appointment and completely forgotten to prepare for it, I've got my 3 questions to start off with. We'll share the website for these in our materials, and there are translated versions of them so that you can have these 3 questions in language for people to help them skill up a bit. The next set of questions we have is the 5 questions to ask your doctor before you get a test, a treatment, or a procedure. So these questions are great to have if someone's, trying to get diagnosed with something new, but just in general, anytime someone's being told they're going to take a new medication, they need to go get a test, they should be asking these sort of questions. So, do I really need this test or procedure? And this isn't to discourage people from getting tests, procedures. It's more about asking that question about, is it going to change the way that you treat me? Because there could be a significant cost in getting the test. It could be that this is just confirming the diagnosis you're already working with. So it might not be as urgent as you think to get that test, which when we're talking about money could be an important factor. Next one is what are the risks? So will there be side effects? Some side effects are really standard and expected, like things like a lumbar puncture. You got to lie down for hours afterwards because it affects your ability to stay conscious when you stand up. That's an expected side effect. And asking about it means, you know, I'm going to have to stay in hospital for a few hours after this. And that might have an impact on when someone can do it. What are the chances of getting results from this that aren't accurate? That's a risk. Could it lead to more testing or another procedure? And in some cases, is it better to just go and get the next test because we're pretty sure about this? Those are all questions that people could ask. Are there simpler and safer options? Because sometimes it might be you can go on say a statin or something to manage your cholesterol, or you could try the healthy lifestyle and diet route first, so you're not taking any medication for the rest of your life. This could include things like doing physiotherapy, all of that. And some people may just not want to get things like surgery because it's quite invasive. Are there other things they can do to start addressing their issues? What happens if I don't do anything? So asking if your condition is going to get better or worse if you don't have that test or procedure right away. The cancer example is a pretty drastic one, is that, well, it could get really serious if you don't go and get this test. But if it's something like the flu, getting more tests to confirm it's the flu or anything might not change how you're treated, and you will probably get better on your own, depending on your circumstances. So what happens if I don't do anything? And then what are the costs? And costs here, similar to the risks we talked about earlier, can be financial, emotional, physical. It could be a cost to your time, things like how much time you got to take off work for this. Is there a cost to community around you? If you're taken out of that, is that cost reasonable to you? Is there a cheaper alternative? And when we're talking about costs, people, again, might be thinking financial, but taking time off work can be really significant for people. Taking time off taking care of kids or something else is a really big cost for some folks. So thinking about what all those could be, weighing it up against the risks. And the idea is, once you get to the end of these questions, you have a good idea of the risk, good idea of the benefit, how urgent it is, and be able to think of that yourself. Before I jump to the next one, just for the group practically, how might some of you share this sort of information with your clients? Any thoughts?
I think just talking about it, and if I had a handout that I could give somebody if they were going to a really important appointment.
Yeah. So handouts, yeah, and talking to people about it. Is there any other things that people are thinking of that they could use to get this information out? I mean, some services I know put out posters for this stuff so they can draw people's attention to them as they come through the service. Again, yeah, the handouts can pop them in your newsletters, those sorts of things, just to get it out there for people. I think excellent. And Penna's just included a link to these 5 questions, and there's videos, posters, all sorts of things to help get them out to people. Word of mouth by peers is a really good one. If you've got a peer support program, things like that, equipping some of the sort of mentor folk with this is really helpful to get it out. Cool. The next tool is, this is sort of the Mac Daddy of question stuff for me. We use this a lot in different talks, and it's this question builder from Health Direct. And Health Direct is also a really great website if you're searching for health information that's reputable, that's Australian, that's in plain English, to make it easier for people to understand. So the question builder is all about preparing ahead of a medical appointment, and I'll run through an example with you now, if I can just grab my other window. Can everyone see my different window, or is it still in the slides? Oh, good. Excellent. Cool. Zoom's stopped the feature where it tells me. So with the question builder, it's sort of buried on the Health Direct website down in the footer. So you'll have to go down here, or we'll send you the link. But what this can be used for is any kind of appointment people are preparing for with a doctor. So we've got the GPs or specialists. So say we're going to a GP and we've got some new symptoms. Next, and it'll run through a few different categories. So assessment, why am I feeling like this? How long will it take to get better? All that sort of thing. What kind of tests do I need? And it's got a few of those 5 questions in there about how might this test change management of treatments? What will this test show? How much will it cost? Those are all built into this. Treatment, what are the options? What are the risks? Medicines, so asking questions about medicines if people think that'll come up. Self-management, what can I do to help myself? Where can I get more information and support? It's a good one to remind people of. And follow-up. Follow-up questions are, I think, sometimes slept on, but how will I know if my symptoms are getting worse and what should I do? Pretty good not to forget those at the end of your appointment. So if we pick a few of these, we'll say, why do I feel like this and what caused these symptoms? Do I need any tests? Do I need to see a specialist? How long will it take to get an appointment? Very relevant at the moment. Do I need any new medicines? What can I do to help myself and get more information? How will I know if I'm getting worse? And we'll go with what should I do? So if we select these, and we hit next, there's an optional section to highlight your most important questions. So if you've only got 5 minutes, which are the ones you really need to get out? So for me, it might be, do I need any tests is a big one? Do I need to see a specialist? Do I need any medicines? And what should I do if I get worse? Those are my top ones. I hit next. You can also, this section, I generally skip it, is questions you think the doctor might ask so that you can prepare for those as well. Things like describing symptoms, medical history, medicines. If someone's really unfamiliar or needs a bit of skill building in preparing for appointments, these questions are really useful to select. And then I hit finish. So what you can do with this, once you get to that, is you can email your questions. I know some doctors will let you email the questions to them, but it lets you pick up to 3 people. So they can, if there's a support person coming with them, whether it's a family member or it's a worker, then they can send it to themselves and to them. And that means that you can have them on your phone if needed. So that's one way to do it. But what I've found really helpful, particularly with older clients, people who aren't so tech literate, is to hit the print version, because it gives a couple of lines under each question where people can write in the answer or get the doctor to write in the answer. Some people I know have found success with just giving the list of questions to the doctor at the start of the appointment. So the doctor can see what they want to discuss and they can make sure they hit all the points. Adds that structure, which if you're in a really quick appointment because they're running through you, makes it a bit easy to get through everything you want. So that's a really valuable tool to help people to ask questions, but also think about all the things they need to prepare for, get ready for, and may identify some gaps, some things they don't understand if you work through it with them. All right. Any questions about Question Builder, Health Direct, anything like that? Okay, all good. So the reason we go through all those question tools is that that's sort of one of the best things you can teach your clients to do and encourage them to do when they're going to appointments. You can kind of work with them to work out a bit of a script so that they can ask those questions in a way that they're comfortable with. So saying things like, I want to understand what I have to do. They know how to say that. and acknowledge for them that it can be confusing. They might feel awkward to go through a list like this, but it's okay to do, and it will really help them. So those are some strategies to address those communication things we were talking about earlier. But I want to go to my last whiteboard and get suggestions from you of strategies or tools you've used or you might know of to support better communication. Even if you've just got an idea, what could we do to address some of those things we talked about earlier? Okay, I'll start reading a few of these off. So what strategies or tools have you used to support better communication or ideas around this? So we've got feedback on what didn't work. Yeah, giving feedback is a big one, making sure that people know, and also what does work. A few times I've sent feedback to a professional to say this worked really well. Can you teach the rest of the people at your practice what you just did with me? Role play with someone, that's a really good one. I've just been doing some modules for parents of very sick kids and thinking about how they might teach their kids, and role play is a really key one, not just for kids, but practicing that to build confidence is helpful. Research with your clients together so that they can go on with as much information as possible. Yeah, that's a really good one, especially if you're trying to build people's skills long term. Then showing them how you research, using some of the tools available from the Commission website. They have some good information about how to find good health information online that you might be able to use to do research together so you can build that skill. Just scrolling across. Offer support worker to take notes or help ask questions. Yeah, that's a really good one. And sometimes support workers might ask about like not stepping outside their role in health related work, and doing something like taking notes and helping ask questions is a practical way to do it without sort of creeping outside your scope. Translator to help with the communication. Yeah, so it's whether you're organizing that or even just reminding people that they can get an interpreter and should ask for one, making sure that they know which number to call for that. Getting some of their translating interpreting service cards to have on hand for people could be a helpful thing to do. I'll just make sure I've got them. Any other ones that are coming to mind while we're here? We noted there that we've got a template on taking medical notes. And that one's sort of built so that you can write in your questions at the top as well as note the answers, similar to Question Builder. So if people want paper notes, they might be that, those sorts of things. Recording things, the audio, because some people use that better, those sorts of things. Following up in writing is one that a lot of people forget about. In this day of email, people still don't email their doctors, and you often can actually send follow-ups so that you can check on things if needed. So those are sorts of things that people can work with. Here's another strategy / tool. So there's a thing called Teachback that increasingly they're teaching doctors to use, which is a method of checking with people that they've understood by getting them to tell the doctor what they've just told them. So the doctor teaches you to use it, how to use your medication. They then go, can you explain to me how you're going to use your medication? Person then explains back to the doctor, this is what I'll do. And if there's any issues, the doctor can correct it. And they repeat that until they understand. So that tool's there for doctors, but there's sort of a flipped version, which we as consumers can use, called Checkback. And I'll just open up the website so you can see it. Because this also includes some e-learning modules for people. So if clients want to learn some ways to advocate for themselves in appointments, there's already stuff here for them. So Checkback has these e-learning modules and also a lot of resources that might be relevant to some of your clients. So it's got information on things like using an interpreter with Checkback. Because it breaks up the information, it can be helpful for that. Overcoming barriers is a really useful fact sheet here as well. Talking about things like the doctors are busy, I'm nervous, I feel embarrassed. So this tool, these resources and these e-learning modules are there to help with some of the issues we've talked about. So you can use that. Just hop back to my slides. I think I've got a video on exactly how checkback works.
So what is checkback? Check to So what is checkback? Checkback is an easy way to make sure you leave a health appointment confident that you understand and can recall what a health worker has told you. There are 4 steps to checkback. 1. Listen closely to what the health worker is saying. 2. In your own words, summarize what they said. You could say something like, "I just want to check I've got everything. Did you say?" Even if you think you've understood, check back. If there is a lot of information, then try to check back as you go. 3. If you have missed something, the health worker may re-explain some points. Listen again, and if you're still not sure, check back again. You could say something like, "Okay, I think I got it this time. You mean I need to?" If they use medical words you don't understand, ask them to speak plainly. 4. If you need a bit more help, you can take someone with you to ask questions on your behalf. Write the information down or ask the health worker to write it down for you. Ask if you can record the conversation on your phone. Ask who to contact if you have any follow-up questions when you get home. So the next time you visit a health worker, will you check to get it right?
So you can see how in that like 2-minute video, we've summarized a lot of the tips that we already have, and it's a strategy for communicating, not just here's a list of questions that you can run with. It's a bit of a method. So this is one that you could use in role playing if that's something that you get to do, or even sharing this video. So that's available. And all the videos and everything are available for free on the Checkback website. The other thing to point out is that Teachback, if you're showing people in any information, is something that you can do to check with people they've understood. So it's a technique you might use in your own work as well. I've certainly, on Teachback, certainly had a carer tell me that that's how they reinforce messages with the person they're caring for, to make sure that they've understood and they've found it really useful. So think about how else you could use it. I want to highlight before we finish up that we have a whole website on health literacy, based mostly in Canberra. A lot of the information is applicable over the border for the New South Wales folks. And I'll just pull this up to show you a few things. If my internet wants to stay. May have popped the link in the chat. I think we're just going a bit slow. There we go. So this website was built as part of a health literacy project, which is what the longer, like 6 presentation version of this talk came from. So we have information specifically for the community sector, and that includes things like how to support the health literacy of your clients, which has all the tools we've talked about, plus some more. And then it has things like organizational health literacy. So if you're looking at how your organization works, you can assess how well you're meeting sort of the mark for health literacy around things like how your building's laid out, how your information is developed for people. And there's quite a few toolkits that we've got in here from all over the world, from Australia. All of it's evidence-based. So I do encourage you to have a look. There's also information about more training, and when we do more sessions like this, we'll go up here, and information on the ACT health system specifically. So you might also jump over to this consumer section and find information around navigating the health system for your clients, communication tips, those questions to ask, rights, and even information on things like using medicines. And we keep this as up to date as we possibly can. If you come across any resources as you're out there practicing this, we'd love to hear about them so we can share them here as well. So just flag that there's way more that you can access here, and any questions about that, any more information you might need on health literacy, we're always happy to share. So there are my details for any further questions, and I'll stop now to see if anyone's got anything else they'd like to ask about, any curly problems you'd like to chat about. And Penne will pop in the chat an evaluation form so we can keep improving this presentation, but also we're planning out what we're doing next year. So if there's particular things that you want to learn about in this space, let us know, because we may be able to put it on as a training. So does anyone have any final questions, comments, things they'd like to share with the group? All right, bit of a quiet bunch. Does anyone have any next steps, things that they're going to take away from today and go and do?
We have a doctor that comes in every Thursday, so right now, I'm probably going to go speak to him and just, ensure that he's speaking and playing language, and sort of maybe get feedback from our service users and see whether that doctor's useful and what we can do to better help them as well.
Yeah, that's a really practical step. I like that. On the Canberra Health Literacy website, we do have a health professional section. So if they want any resources, there's some more there as well. So yeah, excellent. Anyone else got anything they're going to go away and do after this?
I think I'll try the Health Direct question builder myself, and then I can more easily sort of recommend it or use it to help clients.
Yeah, for sure. It's always good to road test these things ourselves. Excellent. Any other ideas from folks? Right. Well, thank you all for participating, especially with the new whiteboard that we've tried out and all of that. I'll make sure I send you everything we've talked about today, and really appreciate your participation. Really hope that this will be useful for you, and keen to have you back at a future training or event if you'd like. And just a reminder that if you have clients that you'd like us to do an education session for about the health system, then we're happy for you to contact. You can get in touch with me or via any of the emails that we've sent you, and we'll help you from there. So have a great afternoon, everyone.